2. The ureter. The ureter is a paired tube-like organ which conveys the urine from renal pelvis into the bladder. The ureter lies behind the peritoneum. The ureter has 3 parts. The abdominal part, pelvic part, intramural part. The abdominal part is situated on the major PSO's muscle and forms a flexure, medially faced at its origin. The right ureter is covered with the duodenum, the left ureter with the duodeno-jejunal flexure, the ovarian, testicular, artery and vena, parietal peritoneum are situated in front of the abdominal part of the ureter. On the borderline, place where abdominal part transforms to pelvic part, the right ureter passes behind the root of the mesentery, the left one, behind the sigmoid mesocolon. The pelvic part forms the flexure facing laterally situated in front of the internal iliac artery and medial to behind the ovary near the uterine artery. Then it goes around the lateral aspect of the uterus neck and in front of the vagina reaches the bladder. In males, the pelvic part of the ureter goes outwards to the vas deferens, crosses it and continue downwards to the seminal vesicle, reaches the bladder. The intramural part runs obliquely through the wall of the bladder. There are 3 narrowings in the ureter. In the region of the origin of the ureter. The region where the ureter transforms from abdominal to pelvic part where the ureter reaches the bladder. The wall of the ureter is composed of mucosa with a submucous layer and adventitia. Outwards the ureter is covered with a fibrous coat. 3. Urinary bladder is a non-paired organ situated in the pelvic cavity. It is a reservoir for urine which enters the bladder via the ureters and leaves it via the urethra. The capacity of an adult bladder is about 250 to 500 milliliters. The anterior, superior part of the bladder is called an apex. The apex without any visible border transforms into the ectatic part, the body of the bladder which goes down and back and forms the fundus. Inferior narrowed part is called the neck of the bladder. The anterior surface of the bladder is separated from the internal surface of the pubic symphysis by the diffused fatty tissue, retro-pubic pool. Between the inferior part of the bladder and pubic symphysis there are suspensor ligaments and muscles which help to fixate of the bladder. The posterior surface of the bladder in males is situated to the front of the rectum and is separated by the recto-vesicular pouch. In females the uterus is situated behind the bladder. Between them there is a vesico-uterine pouch. Below the posterior surface the bladder is attached to the anterior wall of the vagina. The fundus is attached to the urogenital diaphragm. The inferior, lateral surfaces of the bladder in males are in relationship with levator ani muscle. The superior surface of the bladder is attached to the loops of the small intestine, pubo, prostatic ligaments, between the bladder and the prostate. Rectovesicis. From the bladder to the rectum with reference to the peritoneum. The wall of the bladder is consisted of the mucosa, submucosa, muscular and fibrous, partly peritoneum layer. The fold between the ureters forms the base of the bladder's trigone. This fold connects the mouths of the left and right ureters. In the region of the internal opening of the urethra the circular layer forms the internal, involuntary, sphincter. The external coat of the bladder on the superior, posterior and partly on the lateral surfaces is formed by peritoneum, on the other surface by a fibrous coat. 4. Urethra. The male urethra will be studied under male genital organs. The female urethra is a non-paired hollow tube which excretes the urine from the bladder. The female urethra begins with its internal urethral orifice from the region of the apex of the bladder trigone. It ends with the external urethral orifice of the urethra in the vestibule of the vagina. It is fused with the anterior wall of the vagina and passes through the urogenital diaphragm. There are deep recesses in the mucosa. The circular layer of myocytes fuses with the muscular coat of the urethra, forming the internal involuntary sphincter. At the place where the urethra passes through the urogenital diaphragm of the perineum, fibers of the striated muscles which form the external voluntary sphincter surround the urethra.